One of the questions that we received recently was, what are some of the considerations of choosing between CoolSculpting and liposuction other than the use of anesthesia during liposuction? And first and foremost, I want to address the fact that general anesthesia is not necessarily mandatory for performing liposuction. In many cases, we're able to perform liposuction just under local anesthetic, maybe with a little bit of sedation in the office, but in all cases, liposuction in our practice is an outpatient procedure. Other than that, basically, CoolSculpting and liposuction are designed to achieve the same things. Ultimately, we're looking to reduce problem areas of fat pockets, particularly if they're isolated and out of proportion to the rest of your body. It's not just for people who are overweight or just for people who are thin. It's for people that have these fat pockets. Liposuction has been a great option to address these problem areas for many years, and we still do a great deal of liposuction because it's so effective. And certainly there are multiple modalities that we can use when performing the liposuction, which we can address later at a different time. CoolSculpting is trying to reduce these same areas in a little bit different way by using a cooling system to chill the fat so that the body will slowly reabsorb that fat rather than liposuction actually removing it with suction. The differences between the two really come down to the fact that liposuction is technically surgical because we do have to make small, tiny incisions to remove the fat, whereas CoolSculpting is completely non-surgical and non-invasive. CoolSculpting is done obviously with just patients awake, but it often requires more than one treatment, and we don't necessarily see instantaneous fat reduction the same way that we see instantaneous fat reduction with liposuction. It also removes less fat with each treatment than we can remove in one liposuction session. So an optimal CoolSculpting patient is somebody who has a problem area of fat, like we just talked about, but wants something completely non-invasive. They also may be somebody who is open to having more than one treatment. Ultimately, the best way to determine what's the best option for you is to meet with one of us surgeons or with one of our practitioners that's performing CoolSculpting to determine what the pros and the cons in your unique situation are for each, because there's certainly times when one or the other may be the better option very clearly, and then in other cases it's more of a decision for the individual to make in terms of how they would like to proceed and what fits best into their lives.